I want to talk to you today about calf pain, which is, again, it's another very common injury amongst runners, and it's one I'm actually familiar with myself, having suffered it in the past. Now, before I talk to you about calf pain, I'd like to get you to understand the three different types of muscle contraction. So in order to do that, I am going to have to unveil my extremely large ultramarathon runner's biceps. Now, if I take a weight and you concentrate on the bicep, it shortens under load. So the bicep is shortening under load. That's the first one. The second one, the bicep is still under load, the weight's still there, but it's not moving. So it's staying the same length. It's still contracting because it's under load, but it's staying the same length. The third one is the most important one when it comes to runners. It lengthens. So it's still under load, the weight's there, but the muscle, the bicep, is lengthening. That's called eccentric muscle contraction, and that's the one I want to talk to you about with your calves today. Okay, I've put the bicep away so you can come out from behind the drapes now, but hopefully you've got the idea that eccentric muscle contraction is when the muscle lengthens under load. Now, classic case when the calf does this is if you are a mid-foot or a forefoot striker. So you're landing on the front half of your foot. As you land on the front half of your foot, your heel then comes down and your calf is what takes a lot of the shock absorption in that stage of the run cycle. So that's when the calf is at its most vulnerable to calf tear because it's under the most load. So if you are a forefoot striker or midfoot striker, that's where you get the main risk of injury of calf tears, is as your foot strikes. Now, you will know if you've got a calf injury because they're the sort of thing that happens really quickly. As your foot hits the floor, you can feel a pop, or you suddenly feel a pain, and then over the next few steps that pain starts to build up and up and up and up and up, and that's when you might feel the need to stretch your calf. But you will know when you've got a calf injury. It's not something that you're going to be wondering whether it's happened or it hasn't happened. So if you do get a calf injury, the biggest thing is stop at the soonest possibility. Hopefully you'll be able to have a mobile phone and phone for help and get somebody to come and pick you up. If you have to walk back, please make sure that you heel strike so that your heel is hitting the floor and taking the worst of the stress of the calf. Make sure that you do not push off too much so you're contracting the calf too much. You've just got to, if you need to walk home and you've had a calf tear, you just need to try and protect the calf as much as possible. Okay, so we've got home, we've got a calf injury, we know all about it. What do we do? Well, once again, it's that mnemonic RICE. We rest, ice, compress and elevate. So rest means try not to use your calf muscle. Ideally, you'll stay off it for a while. Obviously you need to walk about a little bit, but just try and limit the amount that you do use the calf by walking on it. Ice it, once again, 20 to 30 minutes at a time. Do not apply the ice directly to skin. And you can do that for the first 72 hours for up to about 4 hours a day, as long as it's not more than 20 to 30 minutes in any one stretch. Compress, bandage, calf support, anything you can do if there's swelling there, just to get that swelling under control or to prevent the swelling in the first place. And also elevate, that's where you sit down and you put your feet up, so that's not the worst one to do. So we've got through the first 72 hours, we've got through the inflammatory response, and what do we do then? How do we get ourselves back into running? Well, there's a number of things. The biggest thing is don't try and get back too early. Anyone who's had a calf tear is probably aware of this. If you go too early, ping, it can go again just like that, and then you're right back to square one. So please, 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 please make sure that your return to running is a gradual thing, and that your calf, you can stretch your calf, you can walk, you can do things without any pain before you start going back and training at any sort of level of intensity. We can use a calf support to try and lessen the load that goes through the muscle. Again, we can look at maybe seeing a physical therapist or a strength and conditioning coach to get some exercises. Maybe it's some sort of imbalance that's caused the injury in the first place. So you might want to get checked out by a medical professional. So a good way to strengthen the calf is actually to perform eccentric exercises. Once again, you can look on YouTube or you can Google eccentric calf exercises, but essentially it's where you put your toes on a step and you raise your legs up and then lower down, but it's the lowering that is the important bit for the eccentric loading. So when you contract your calves and you go up and then you lower yourself down and get your heels down below your toes off a step, the lowering, don't cheat yourself, make sure you do it nice and slowly and nice and controlled, because that's the bit that is going to strengthen your calves up. Now the last thing I want to talk to you about calf injuries is, briefly touched on it at the beginning, about mid-foot striking, forefoot striking, and this big debate on whether it's more efficient than heel striking. The current thinking at the moment is that it's not how your foot lands on the floor that is the massively important thing, and a lot of people are getting calf injuries because they're trying to force themselves to strike the floor with the forefoot or the midfoot, as opposed to the heel, because there's this sort of current thinking that the heel striking is inefficient. Personally, I wouldn't worry about how your foot's landing. If you're going to make a change to your running style, make sure it's how you toe off. So how you push off from your toes, don't push off from your big toe, push off slightly outwardly, so the other four toes are where you're leaving the ground, where you're pushing off from your toe. That is more important than how you land.